Welcome back to the Deep Dive, where we take a stack of dense source material and give you the shortcut to being truly well-informed.
Today, we are diving deep into a topic that really haunts our collective imagination more than almost any other.
Radiation. And more specifically, the crippling, and as we'll see, often fatal, fear of it. Our focus is on radiophobia, the real danger.
It really is the ultimate invisible adversary, isn't it? It's that, magic, uncontrollable poison that pop culture has just drilled into our minds since the mid-20th century.
So what is radiophobia, in simple terms?
Simply put, it's an irrational or an excessive fear of ionizing radiation.
And this fear makes us what?
It causes us to dramatically overestimate the health risks from low-level exposure compared to, well, virtually every other hazard we face on a daily basis.
So our mission today is to try and reset that perception. And I think to do that, we're going to need a cognitive tool, a new way of thinking about this.
We absolutely do, because we're making the case that radiophobia, so the fear itself, the policy overreactions, the media frenzy, that's actually the real catastrophic force we should be worried about.
Okay, so to do that, you're saying we need to stop thinking of radiation as just this evil, invisible poison.
Exactly. We need a fundamental shift in perspective.
All right, so let's try an analogy, maybe something simple we could all grasp. Let's compare radiation to fire.
I like that. Fire.
Fire is terrifying, right? It's extremely dangerous when it's uncontrolled. Think of a massive industrial explosion or a huge forest blaze.
Uncontrolled fire can cause just massive damage and death almost instantly.
And that's your nuclear accident or a weapon. That's the uncontrolled fire, pure catastrophe.
But
fire is also absolutely essential to our entire civilization. It's the managed fire that cooks our food, that keeps our homes warm, that sterilizes our medical equipment.
And it drives the turbines and power plants all over the globe. It's profoundly beneficial, even life-saving, when you contain it and manage it properly.
So radiation is the managed fire.
Precisely. When it's contained and used purposefully, it saves and improves countless lives. Every single day.
Like medical imaging, X-rays.
Medical imaging, which diagnoses illnesses we'd never see otherwise. Targeted cancer treatments that destroy tumors with precision. And of course, providing enormous amounts of low-carbon power that keeps our cities running.
But the problem is, we only focus on the catastrophic house fire part, the dramatic, immediate danger.
And when you do that, you develop this crippling, irrational dread.
So today, we're focusing on the fear of fire, which, in the case of nuclear energy, sometimes causes people and entire governments to make decisions that are, well, exponentially more dangerous than the radiation itself ever was.
And that right there is our thesis for this deep dive. We're going to stress how many lives nuclear energy and radiation benefit or save, which is in the millions, and crucially, how vanishingly few lives have been harmed directly by radiation accidents.
Especially when you compare it to the vast number of lives harmed or lost because of that irrational fear, because of policy overreactions, and because we have to rely on older, dirtier energy sources when nuclear gets taken offline.
That's the story we're telling today, the fear versus the reality.
Okay, let's start by dissecting the fear itself. Why does radiation, out of all the possible environmental risks out there, trigger this excessive, just completely outsized fear? Even when the actual exposure dose is tiny? Sometimes it's equivalent to flying from New York to LA. Why the panic?
It's because radiation hits a perfect storm of psychological risk perception triggers. Humans worry excessively about risks that share a few key characteristics.
Okay, so what's the first one?
The first is what I'd call the ghost factor. We can't detect it with our senses. You can't see it, you can't smell it, or taste it, or feel it.
So invisible risks are just inherently scarier.
They are. If you see a truck barreling toward you, you know the risk, you can react. But if an invisible threat is supposedly all around you, even if it's negligible, it's the uncertainty that breeds the panic.
The lack of control.
That's it. The second factor is its association with catastrophic harm. The public's perception of radiation isn't rooted in, its daily medical uses. It's rooted in its historical origin.
Nuclear weapons?
Nuclear weapons. The fear is just deeply rooted in that Cold War anxiety that the world could end in a flash.
You've mentioned before that the 1954 Castle Bravo hydrogen bomb test was a key moment for this global radiophobia.
It was a seminal moment, absolutely. That test produced this unanticipated visible nuclear fallout, they called it bikini snow, and it contaminated a Japanese fishing boat, the Lucky Dragon.
And that story went global.
It went global, instantly. That incident Combined with all the government secrecy and the dramatic consequences for the fishermen, it created this widespread, immediate fear, not just of weapons, but of radioactive food, of contamination in the environment. It really created the image of the ultimate, unpredictable threat.
And that image just gets reinforced in movies and pop culture for decades.
For decades, which leads to the third trigger. Risks that are man-made versus ones that are natural.
Right. We tend to accept natural risks, like living near a volcano or the risk of a lightning strike,
Far more readily than risks engineered by humans, especially when those risks have these fearful names attached to them, like Chernobyl or Fukushima.
So you've got this recipe for a complete communication breakdown. You have experts who deal with the math and the probability.
And you have the public, who deal with the emotion and the history. It creates a chasm.
How so?
When experts and the general public look at the exact same sources of radiation, they see entirely different risks. It's fascinating.
Or experts worry about things we don't.
Exactly. Experts perceive the risks from natural background radiation, the radiation you absorb just by living on Earth, or from routine medical X-rays as surprisingly high, often much higher than the general public does.
And conversely.
Conversely, when it comes to nuclear waste or fallout from an accident, the public perceives those risks as dramatically, almost universally higher than the experts do.
The experts see low probability, manageable events.
Right. And the public sees the inevitable, uncontrollable catastrophe. And bridging that communication gap, understanding that fear is what drives the policy, that is the absolute heart of this deep dive.
And a massive driver of that catastrophic public perception.
Yeah.
And the policy failures we're about to discuss. It all comes down to a scientific model that has governed radiation safety for over 60 years.
Yes. We have to talk about the linear no threshold model.
LNT.
LNT. Okay, break that down for us.
This model is arguably the single most important factor in understanding why radiophobia became, well, institutionalized. In simple terms, the LNT model assumes that any exposure to radiation, no matter how tiny, like even a single radioactive particle,
Even a single one theoretically increases your risk of cancer. And that risk increases linearly, in a straight line, with the dose.
with no threshold.
With no threshold below which radiation is considered completely safe.
Now, when you hear that, it sounds inherently cautious, right? It sounds responsible.
Yep.
Isn't applying the LNT model just the gold standard of caution?
And that was precisely the intent. When it was adopted back in 1959, it was chosen largely for administrative simplicity. It was a philosophy of protection, not a proven biological law.
Just an easy way to set rules.
The easiest way, assume a straight-line relationship between dose and effect, even at vanishingly small exposures.
Okay, but if we're going to need a deep dive based on modern data, we need to be really clear here.
Yes.
We are explicitly not using statistics based on the LNT model in this discussion.
That is absolutely fundamental. We cannot, because LNT is mathematically convenient, but it's biologically inaccurate at low doses.
Where's the critical flaw?
The flaw is what happens when you apply it to large populations. If you use LNT to calculate theoretical cancer deaths from, say, a tiny, undetectable release of radiation over a country of 100 million people,
You multiply a tiny theoretical risk by a huge number.
and you generate these ridiculous, hypothetical, politically explosive death tolls that just do not materialize in reality.
It's like a math trick that creates phantom deaths.
It confuses theoretical risk with confirmed biological reality. It's like saying that because you can get skin cancer from excessive sun exposure, walking outside for 1 minute guarantees a certain number of cancers across the entire state of California. The math works on paper, but the body doesn't work that way.
Why not?
Because the body has repair mechanisms. The human body is incredibly resilient. We evolved in a soup of natural radiation.
From space, from the ground.
From cosmic rays, from the granite in the ground, from the food we eat, from medical procedures. The key scientific consensus we're relying on here is that there's weak statistical evidence and, crucially, no biological evidence that doses below 100 millisieverts.
And 100 millisieverts is a pretty significant dose.
It's a very significant level of exposure. There's no biological evidence that doses below that have any discernible adverse effect. The body's repair mechanisms kick in and they handle it.
So LNT is what gives us the bogeyman. It suggests even the smallest exposure is guaranteed doom, which in turn drives panic and, as we're about to see, some truly terrible policy.
Exactly.
Let's get into it. Part 2, Chernobyl, 1986. I mean, this is the word most associated with nuclear catastrophes.
It's the genesis of modern institutionalized radiophobia.
So when we strip away all those LNT-based predictions and we look only at the confirmed, verifiable data, what were the actual deaths attributable directly to radiation exposure?
For this, we have to rely on the comprehensive reports from UNSCEAR, the United Nations Scientific Committee on the Effects of Atomic Radiation. They track these events meticulously.
And what does the data say?
The data is definitive. The total confirmed deaths attributed directly to the Chernobyl accident as of 2008 were 45.
45. 45 confirmed direct radiation deaths. Let's break that number down. How did those deaths happen?
Okay, so that number includes 2 non-radiation fatalities that happened right at the site during the explosion itself.
Right.
Then you have 28 fatalities from what's called acute radiation syndrome, or ARS, and these were in the immediate months following the accident.
And just for clarity, ARS isn't something you get from a tiny exposure 1,000 miles away.
No, not at all. ARS is an overwhelming illness. It happens when you get a massive whole-body radiation dose over a very short period of time.
So the first responders?
The immediate emergency responders, yes. The firefighters and plant workers who rushed in during those first few hours, their systems were just completely overloaded by the radiation.
Okay, so that's 30 deaths accounted for. What's the final category?
The final 15 were fatalities due to thyroid cancer.
And this was from a specific isotope?
Yes, this was caused by the release of iodine-131, which is a short-lived radioactive isotope. The body naturally concentrates any iodine it takes into the thyroid gland.
So it got into the food chain?
It got into the milk and food, and because children were exposed, especially those with the highest doses, some developed thyroid cancer, resulting in those 15 deaths over the following years.
Which, and this is an important point, is a risk that is largely preventable with stable iodine tablets, right?
It's almost entirely preventable, yes. The policy failure there was a lack of prompt distribution of those tablets, which basically flood the thyroid with non-radioactive iodine, blocking the uptake of the dangerous stuff. It was a failure of preparedness, not an unavoidable consequence.
Okay. 45 confirmed direct radiation deaths. That stands in just stark contrast to the massive, terrifying figures you hear from activist groups suggesting death tolls in the hundreds of thousands.
And those high numbers are a direct result of applying that flawed L&T model to the millions of people across Ukraine, Russia, and Belarus. You just generate hypothetical cancer cases that have simply not appeared in the data.
So the confirmed 45 deaths, verified by international scientific bodies, is the only data point we can trust.
It is.
So let's log that with our first report card to really cement the reality versus the fear.
Okay, report card 1. Chernobyl radiation versus fear. Deaths caused by radiation, acute and confirmed cancers, 45 confirmed deaths.
As on the other side.
Deaths caused by fear and policy, things like psychosomatic illness, suicide, other indirect causes, hundreds of thousands.
That second number.
Yeah.
The hundreds of thousands.
Yeah.
It's just chilling. Where did all that human suffering and reduced life expectancy come from if it wasn't the radiation itself?
The single largest public health problem from Chernobyl was psychological and social and economic. We are talking about a full-blown mental health crisis that was catalyzed by radiophobia. People were told they were contaminated, they were tainted, they were doomed, and then they were relocated, which just tore apart their social and family structures their entire lives.
That anxiety and displacement must have had serious physical health consequences over time.
It did. The research is clear. Rates of depression doubled among the affected populations. Post-traumatic stress disorder was widespread. Anxiety, alcoholism, suicidal thinking, it all increased dramatically.
And the most profound finding.
The life expectancy for the evacuees dropped significantly. It went from about 65 down to 58 years.
7 years of life lost. But not primarily because of cancer?
Not because of cancer. This decline was primarily attributed to the effects of long-term depression, alcoholism, and suicide. It came from the displacement, the chronic worry, the loss of social identity.
So the belief that they were victims of Chernobyl, that belief itself?
That belief, which was fueled by persistent misleading messaging, it killed them before the actual radiation ever could.
Can you give some context on the actual exposure levels for these millions of people who are living in this fear?
Yeah, this is key. In many of these so-called highly contaminated regions, the average annual dose people received was often only about 1/3 of the average dose of natural background radiation they would get just living in other parts of the world.
So the psychological terror of being labeled contaminated was the real poison.
It far, far outweighed the physical reality of the exposure.
This psychological effect must have been especially bad for the liquidators, right? The cleanup crews.
It was. And that group, the 300,000 to 900,000 people involved in the cleanup, They provide a fascinating, almost tragic case study on the link between mind and health.
What did the observations show?
They suggest that the workers who had been permanently employed at the power station before the disaster,
The career guys?
the career guys who often had positive, optimistic psychological profiles and a real sense of mission, they did not get sick as often as those who came in after the accident.
So their baseline psychological state was a bigger predictor of their health than the radiation dose they got.
That's the strong suggestion. The new liquidators, they faced immense mental health issues, but not necessarily from radiation-induced cancer in the long term. It was from debilitating anxiety, PTSD, and the social ostracization they faced when they went home
They were treated as damaged goods.
as contaminated pariahs. And this had a lasting, detrimental effect on their physical and mental well-being.
So if the psychological cost near the site was catastrophic, the policy costs far away were, well, arguably even more devastating and almost completely overlooked.
This is perhaps the most shocking data point of all. The one that truly defines the danger of radiophobia.
We're talking about the elective abortions across Western Europe, hundreds, even thousands of miles from the accident.
Yes, this is the real tragedy. Walk us through how this happened. We're far outside the direct blast zones of Ukraine and Belarus. So after Chernobyl, you have this intense media coverage that drives widespread, uninformed panic across countries like Germany, Austria, Italy, Sweden, Denmark.
And a public, fearing this invisible contamination, they rush to their doctors.
They do, but the medical community, lacking immediate education in radiobiology and radiation protection, often succumbed to the pressure and shared the public's anxiety.
They advise caution based on fear, not on science.
Exactly. Physicians wrongly advised many pregnant patients that the minimal, often negligible, radiation fallout posed a significant risk to their unborn child, particularly the risk of severe birth defects.
How negligible was the actual risk for a fetus in, say, Germany or Italy?
It was statistically non-existent. The actual dose increase received by pregnant women outside the immediate USSR was minuscule. It posed no discernible risk to the fetus.
But the policy consequence was.
The consequence was massive. Estimates suggest that somewhere between 100,000 and 200,000 elective abortions of otherwise normal, healthy pregnancies occurred across Europe.
All out of a crippling fear of radiation harm to the unborn child.
Yes.
Let's just pause on that number for a second. 45 confirmed radiation-related deaths at Chernobyl, mostly workers who got massive doses. And an estimated 100 to 200,000 healthy pregnancies were terminated because of fear alone.
That is the direct, undeniable, and overlooked human catastrophe caused by radiophobia. It's a tragedy that just dwarfs the direct radiation toll. It happened because of the panic driven by a lack of education about the actual risks.
How could the medical community get this so wrong?
It was likely a toxic mix of everything. Institutional radiophobia, ignorance of basic radiobiology, and just succumbing to immense public pressure, all amplified by sensational media that had no context for radiation doses.
And the LNT model, I assume, gave scientific cover to those precautionary fears.
It did. The result was this massive tragedy imposed by policy and misinformation. It proves beyond a doubt that fear is a far more potent and geographically widespread killer than actual radiation exposure.
Okay, let's jump forward to 2011, the Fukushima Daiichi nuclear disaster in Japan.
Triggered by a gargantuan earthquake and a massive tsunami, the world watched in horror as cores melted down.
And the immediate reaction was a new massive wave of global radiophobia.
It was. But Fukushima provides perhaps the clearest case study of fear trumping data. And that's largely because the plant, despite the catastrophe, was designed to contain radiation far more effectively than Chernobyl.
So what was the direct safety record? How many radiation casualties were there?
It's remarkable. Despite core meltdowns in 3 reactor units, there were no radiation casualties. That means no cases of acute radiation syndrome among either the public or the plant workers. Zero. And furthermore, UNSCR concluded that the overall health risks from Fukushima are far lower than Chernobyl. And this is the crucial part. Future radiation-associated health effects, including cancer, are unlikely to be discernible above the natural background cancer rates in the population.
So a triple meltdown, triggered by the world's 4th largest recorded earthquake, and the radiation risk to the public was statistically undetectable.
Correct.
So let's look at that second report card, focusing on where the deaths actually came from.
Okay. Report card 2. Fukushima radiation versus fear policy. Deaths caused by radiation. 0 confirmed acute deaths, and future cancer increase unlikely to be discernible.
And the deaths caused by fear and policy.
More than 1,656 immediate evacuation deaths, plus an estimated 7,710 annual premature deaths because of the energy policy changes that followed.
That first number just jumps out. 1,656 immediate evacuation deaths. How could a precautionary measure designed to save lives from an undetectable threat cause so many deaths?
The decision to hastily evacuate 154,000 people was based on extremely conservative safety zones, driven by political precaution and overwhelming public fear. The policy completely failed to account for the non-radiation physical consequences of moving vulnerable populations.
The evacuation itself was the disaster.
It was. The Japan Times and other sources confirmed over 1,656 people died because of the evacuation.
And the original tsunami killed about 1,607 people in that specific area.
That's right. The evacuation was literally deadlier than the earthquake and tsunami combined for that region.
Who were these victims?
They were overwhelmingly the elderly. About 90% were 65 or older. Moving fragile, institutionalized people rapidly, tearing them away from their social and medical support networks, and sticking them in unprepared temporary housing. It proved to be a fatal stressor.
I imagine nursing homes were hit especially hard.
It was harrowing. We have specific data on nursing home residents in Minnesota, an area that was near but actually outside the compulsory evacuation zone.
And what happened when they were relocated?
Their mortality rates drastically increased. It was due to the trauma of the move, changes in staff, disruption of routines, and poor conditions at the new sites. It's conclusive evidence. The stress of relocation was definitively deadlier than the radiation risk they were being moved away from.
And just like Chernobyl, the long-term effects on the dislocated population were a wave of psychological and physical health issues.
A huge wave. Increased rates of obesity, heart disease, diabetes, depression, anxiety, PTSD. The fear of being a victim became a pervasive, long-term chronic illness for thousands.
Okay, now let's address that other number, the ongoing death toll. 7,710 annual deaths.
Yes. Following the disaster, Japan shut down virtually its entire nuclear energy production. It had supplied roughly a quarter of the country's electricity. This was the ultimate policy decision driven by radiophobia.
And replacing a quarter of a modern nation's power is massive. That energy had to come from somewhere.
And it came from imported fossil fuels, primarily coal and natural gas.
Which caused two big systemic problems.
The first was that it drove up electricity prices substantially, by as much as 38% in some areas. And this price hike had a devastating but largely unseen consequence on public health.
This is what some people call thermal poverty.
Precisely. Higher electricity prices led to decreased consumption, particularly for essential climate control heating in winter and cooling in summer.
And there's research linking this directly to deaths.
There is. A key study connected this reduced consumption directly to an estimated 7,710 premature deaths every single year in Japan.
7,710 deaths every year, silently, because people couldn't afford to run their air conditioning or their heating.
And the data backs this up. Around 60% of those excess deaths happened during the summer months, which correlates directly with the lack of AC access during heat waves.
So the political decision, driven entirely by fear, traded a statistically undetectable radiation risk for a massive chronic death toll.
It was a profound policy failure where the precautionary principle ended up killing thousands of people every year.
Okay, so we've established the fear vastly outweighs the risk. Now let's try to contextualize nuclear energy's safety record against the energy sources we rely on every day without a second thought.
Right. When you look purely at occupational health and accidental impacts, so how dangerous the job is and how many people die in accidents producing that energy. Nuclear power has historically one of the lowest impacts on human health compared to virtually all other major energy sources.
How do we measure that fairly?
We use a standard measure called a GWAY, a gigawatt electric year. It's a way to compare apples to apples. It measures how many people die per amount of electricity reliably produced over a year.
And that includes everything: mining, construction, operation.
An entire life cycle. It's the industry standard for risk comparison.
So using that metric, how does nuclear stack up, even including the major accidents?
Even when you factor in the historical toll from 3 Mile Island, Chernobyl, and Fukushima, it's incredibly low. The death rate from the Chernobyl facility, for example, is calculated at 0.86 deaths per GWAY year.
Which sounds abstract. How does that compare to something else?
That rate is 9 times lower than the death rate from liquefied gas. In fact, the nuclear power industry has one of the highest worker safety standards in the world, with one of the lowest rates of worker injury or death.
Let's quickly address the current panic around Fukushima's water discharge plan. Japan plans to release treated water containing trace amounts of tritium.
And the public panic is again driven by fear of the unknown. The reality is the water is being treated to remove virtually all radionuclides except for tritium. And tritium is a very weak radioactive particle.
And they're releasing it slowly.
Very slowly, over 4 decades, and it will be dramatically diluted.
How diluted are we talking?
The tritium dose in the released water will be 1/40th the allowed dose in Japanese drinking water and 1/7th the level allowed by the WHO.
And here's the crucial context point, right?
Tritium naturally forms in our atmosphere constantly from cosmic rays and literally rains down on us. The proposed discharge is entirely consistent with and often lower than the practices for nuclear plants worldwide. It poses a negligible risk compared to the background radiation we already absorb every day.
Okay, so if radiophobia is the fear of the invisible, let's look at an energy source that is massive, obvious, and human-made, but whose risks we seem to accept without question.
Hydropower.
We don't have hydrophobia.
No, we don't. And hydroelectric dams are the perfect foil. They are these physically imposing engineering marvels, but because they're familiar, it's just concrete and water, they don't carry that same psychological dread as the invisible ray.
But historically, the accidents have been magnitudes deadlier.
Oh, absolutely. Between 1970 and 2008, hydropower accidents, while few in number, caused 38% of the total accidental deaths in the entire energy sector.
And the Bankyo catastrophe in China in 1975 provides a terrifying, often ignored comparison to Chernobyl.
It's staggering. This dam failure was caused by a typhoon, plus engineering flaws and policy failures. It led to the collapse of 62 dams downstream. It affected over 10 million people and destroyed 5 million homes.
What about the death toll?
The estimates vary, but if you include the massive indirect deaths from the famine and epidemics that followed, the range goes up to 240,000 people.
250,000 lives lost from a single dam failure.
250,000.
So if we use that same GWE safety metric, how does that one hydro accident compare to Chernobyl?
The death rate from hydroelectric stations, including Bankyo, is calculated at 40.19 deaths per GWE year. That rate is an astonishing 47 times higher than the early death rate from the Chernobyl facility.
47 times higher. And yet, we rarely discuss this or demand the immediate shutdown of all dams.
Not at all. And it's not just a relic of the 70s. We saw the same kind of tragedy just recently with the Derna Dam failure in Libya in 2023.
Fresh example.
2 dams collapsed after a storm, releasing a massive torrent of water. Official confirmed deaths were over 4,500, but local estimates suggest the final death toll could reach 18,000 to 20,000 people.
So 2 dam collapses, thousands upon thousands of deaths, and it just doesn't capture the political imagination or global regulatory fear that a statistically negligible release of tritium water does.
That is the power of radiophobia overriding rational risk assessment. The real systemic risks are staring us in the face. Massive concrete structures failing, causing instant, overwhelming fatality. But the invisible magic cancer ray holds this unique, disproportionate psychological grip.
So if hydro is the great accidental killer, then fossil fuel is the great chronic, slow killer that we've completely normalized.
And this is the most devastating contrast of all. This is the biggest systemic risk factor. The most widespread source of energy-related harm globally is burning fossil fuels, coal, oil, biomass. The health impact is chronic, not acute, and it's primarily driven by air pollution.
And that pollution causes a global health issue that dwarfs even the worst catastrophe in nuclear history.
Ambient and household air pollution from burning these fuels is one of the main risk factors to human health worldwide. Current estimates of premature deaths from this are staggering.
How many?
Over 6 million people every year globally.
6 million a year.
This chronic exposure drives respiratory diseases, heart attacks, strokes, lung cancers. It is a perpetual, normalized annual disaster that we just accept in exchange for electricity.
And this brings us right back to Japan. When they shut down their nuclear power to mitigate a non-existent risk, they replaced that clean energy with imported fossil fuels.
Contributing simultaneously to local air pollution and global climate change, it's the ultimate perverse outcome of policy driven by fear. Nuclear power is a crucial low-carbon energy source.
And with the severe looming consequences of climate change, which will cause exponentially greater harm globally than any nuclear accident ever could, it's imperative that we use all available tools.
We have to. The focus must shift immediately from the highly unlikely headline-grabbing nuclear catastrophe, which has a confirmed historical death toll of 45 people, to the constant, pervasive, and deadly reality of fossil fuel pollution and the existential threat of a warming planet, which kills 6 million people every single year.
So at the end of the day, what does this all mean when we put it together?
It means that in both major nuclear accidents, the world has obsessed over Chernobyl and Fukushima. The policy decisions driven by radiophobia, by the fear itself, created human suffering and mortality that far, far exceeded the direct, measurable, and confirmed consequences of the radiation released.
The fear was the more potent killer.
Absolutely.
Whether it was the estimated 100,000 to 200,000 healthy pregnancies terminated across Europe after Chernobyl, or the 1,656 elderly Japanese citizens killed by a rushed, unnecessary evacuation after Fukushima, the invisible bogeyman convinced us to commit a greater harm upon ourselves.
We have to shift our focus away from the exaggerated, dramatic, invisible risks that capture our headlines and prevent rational policy, and toward the pervasive, chronic risks like air pollution and preventable dam failures that kill millions but fail to capture our imagination or our political will.
So the real danger when it comes to nuclear power is not the radiation we can barely detect. It's the irrational, ingrained fear that prevents us from adopting the energy solutions that are vital for addressing climate change and saving millions of lives lost every year to fossil fuel pollution.
We have been fighting the ghost. While the real, systemic monsters walk among us, we've established the data. And the question for you, the listener, is how do you challenge the ingrained cultural stories about the invisible bogeyman when they enter the public debate or the voting booth? The biggest risk is choosing our energy solutions based on historical trauma rather than modern data.
Thanks for coming along on this deep dive with us. Remember to follow us on your favorite podcast platform, and see you on the next dive.